Good afternoon, everyone. Today I'm going to talk about the lateral aspect of the brainstem. And let's dive in. The lateral aspect of the brainstem is here in this illustration, and this is probably the critical region that will house numerous neural structures that will be involved in motor control, sensory processing, and autonomic functions. Let me just talk about each one of these structures labeled here. So first, starting with the midbrain. The midbrain is the most rostral or superior part of the brainstem, and it contains important nuclei, important structures called nuclei and tracts. Also include the cerebral aqueduct, red nucleus, substantia nigra, and periaqueductal gray matter. When damaged, the midbrain, this can result in conditions such as Parinaldi syndrome, and which affects the eye movements and the vertical gaze, and Parkinsonian symptoms that may raise from damage to the substantia nigra that produces the dopamine. Now we have here the trigeminal nerve, and the trigeminal nerve is responsible for sensory input from the face and motor control of mastication muscles. And it roots exits the brainstem, okay? And what else? Access the brainstem at the level of the pulse. This is the most important thing, okay? Disorders affecting the trigeminal nerve, we can include trigeminal neuralgia, which is a severe facial pain, and Bell's palsy-like syndromes if motor fibers are affected. Then we have the basilar part of the pons, which is the ventral portion of the brain, which is the ventral portion of the brainstem segment, okay? The basilar part of the pons. And this part here contains ascending and descending fibers, as well as cranial nerve nuclei. Lesions affecting this area cause locked-in syndrome, which is when the patients are aware but unable to move or communicate due to bilateral corticospinal tract damage. Then we have the facial and the vestibulocochlear nerve, okay, which are the cranial nerves. Just put the number of these cranial nerves in the comments. So here we have the facial nerve, okay, facial nerve here, and the facial nerve is responsible for facial muscle movements and taste sensations in the anterior 2/3 of the tongue. Damage to this nerve will result in facial paralysis, commonly seen in Bell's palsy. Now, the vestibulocochlear nerve will carry auditory and vestibular information from the inner ear. Lesions here will usually affect the hearing, and also cause vertigo. Yeah. Then we have the pyramid of medulla oblongata, and the pyramid is formed by the descending corticospinal tracts that will carry voluntary motor signals from the cerebral cortex to the spinal cords. Damage to the pyramids results in contralateral hemiplegia, which is the weakness on the opposite side of the body, and this is often seen in stroke or trauma affecting the brainstem. Then we have the olive here, and the olive is a prominent oval-shaped structure located on the lateral surface of the medulla oblongata, and contains the inferior liver nucleus, which plays an important role in motor coordination. Lesions affecting the olive, okay, can disrupt motor coordination. More commonly, it is affected in disease like multiple sclerosis. Yeah, just have a look at this. I think that it might be relevant for if you want to work with neurophysiology. Well, then we have posterolateral sulcus of the medulla, and this is a groove on the lateral surface of the medulla that separates the dorsal column nuclei from the other structures. Okay, this one here. And this sulcus is clinically significant because it is the seat where cranial nerves 9, 10, and 12 exit from the brainstem. Lesions here can affect these nerves, leading to swallowing difficulties and even vocal changes. Now, the tuberculum cinerum, which is this structure here, tuberculum cinerum, is a small elevation on the dorsal surface of the midbrain, and it contains the superior colliculus. Okay, and let's say when affecting us, let's say for some reason this area is affected, it will involve the areas of visual reflexes and eye movements. Also, damage can result in impaired visual tracking and vertical gaze palsy. Then we have the superior colliculus here, and the superior colliculus is located on the dorsal aspect of the midbrain, and it's involved in visual reflexes and saccadic eye movements. Lesions here can impair visual attention and eye movements, which contributes to vertical gaze palsy. Then we have the inferior colliculus. See, if we have the superior, here is the inferior. Okay, and this is located on the dorsal aspect of the midbrain, and here this area processes auditory information. Damage affects the auditory processing and localization of sounds. Below here, we have the middle cerebellar peduncle that connects the cerebellum to the pons and carries both afferent and efferent fibers. Lesions here can result in cerebellar dysfunction, leading to ataxia, which is impaired coordination, and dysmetria, which is inaccurate limb movements. Down here, we have the ventrocochlear nucleus that is located in the medulla and processes the auditory signals from the cochlea. Damage to this area can lead to sensory neural hearing loss. And the last three structures are the inferior cerebellar peduncle, this one that connects the cerebellum to the medulla and will carry fibers involved in motor coordination. Lesions here can cause ataxia and imbalance, and is quite often seen in conditions like multiple sclerosis and vascular insults. And then we have the cuneate tubercle, cuneate tubercle here, that is a raised area on the lateral surface of the medulla and containing the cuneate nucleus. And this cuneate nucleus processes sensory information from the upper limbs and trunk. When damaged here, this can result in sensory deficits in the upper limbs, and such as loss of fine touch and proprioception. And finally, we have the gracial tubercle, which is located ventral to the cuneate tubercle and contains the gracial nucleus, which processes sensory information from the lower limbs and trunk. Lesions here cause sensory deficits in the lower limbs and similar to those seen with damage to the cuneate tubercle. So this is pretty much what I wanted to share with you guys. I hope the topic makes sense and help you with your studies. And don't forget to share, subscribe, follow me. And I also have my Instagram, which is the same name of my YouTube channel. Please consider to follow me on Instagram as well. So I hope to see you next time. Cheers.